Hi, I'm Oliver Warren. I'm a colorectal consultant surgeon here at Welbeck in London, and I also have a busy NHS practice at Chelsea and Westminster Hospital, where I'm the clinical director of surgery.
Good afternoon, my name's Alex von Roon. I'm a consultant colorectal and general surgeon here at Welbeck. In the NHS, I work at University College London hospitals, where I have a busy and complex tertiary Raphael practice.
Hemorrhoids are a really common condition that we see here in clinic at Welbeck. They are cushions in our bottoms, and everybody has hemorrhoids. They are anatomical structures. So when people say, oh, I've got hemorrhoids or I've got piles, what they really mean is that they're having some sort of problem with them. That can range from throbbing and pain during the day, or after prolonged periods sitting, or after opening their bowels, or alternatively could be bleeding, or can be prolapse of those cushions outside the bottom, particularly when sitting down, opening your bowels, and noticeable when wiping your bottom. Hemorrhoids are a really common condition that we see in clinic, and around 80% of people will be troubled by their hemorrhoids at some point in their life. Fortunately, they're a benign condition, so they don't have a risk of turning into anything nasty like cancer.
There are several ways of categorizing hemorrhoids. The most well-known classification is the Gallagher classification, and that is graded from grade 1 to 4 in order of rising severity. So grade 1 are small, usually internal hemorrhoids that bleed only. Grade 2 are still relatively small hemorrhoids that come out when the patient opens their bowels, but they go back inside by themselves. Grade 3 hemorrhoids are larger and come out on opening the bowels and require the patient to push them back inside with their hand. And grade 4 hemorrhoids are larger still and are always out and are not reducible.
Most patients undergoing a radiofrequency ablation of their hemorrhoids, or Rafaelo as it's commonly known, would come to our treatment centre here on the first floor at Welbeck. Most patients like to have a small amount of sedation, so they're not fully anaesthetised, but relaxed, a reduction in any anxiety that a patient might be feeling, and not fully aware of what's going on. Patients will lay on their left-hand side, and through the bottom a small plastic tube is placed that the surgeon can look down to see the hemorrhoids. The hemorrhoids are then lifted off the underlying sphincter complex, so that's the muscles that help us control our bowel action, with local anaesthetic, and a small probe is placed into the hemorrhoid. That probe has a tip which emits radiofrequency energy. This generates heat and reduces the blood flow into that hemorrhoidal cushion. Each of the hemorrhoids receives maybe 90 seconds to 2 minutes of energy, and normally 2 or 3 hemorrhoids will be treated in any one visit. So the whole period that the patient is lying there having that treatment would be often no more than 10 minutes.
So I think from a patient's perspective, the main benefit of the procedure is that you can treat really quite large hemorrhoids, large third-degree hemorrhoids that cause a lot of symptoms of often prolapse and bleeding with this procedure, and get a very good result in terms of symptom reduction for a relatively low price of pain afterwards.
A lot of patients will ask me, how likely is it that this will fix the problem? And I think it's important that we delve into that. We're not looking to remove people's hemorrhoids. Hemorrhoids are really important structures that do an important role inside the anal canal. They act as cushions, and they also have a very rich nerve supply, which allows us to ascertain what is going on in our rectum and in the top of the anal canal. So we don't want to completely destroy somebody's hemorrhoids. However, having said that, quite understandably, most patients want to feel that they've had a treatment and they won't need to keep coming back to the doctor. And here, Rafaelo is a very good treatment. Most of the studies published, and my own data, along with that of Mr. Alex von Roon, who I work with here at Welbeck delivering this treatment, we see that about 80% of patients who have a Rafaelo done will not have any other treatment for their hemorrhoids after that for at least 3 to 5 years. This gives patients peace of mind that they're not going to have to keep on coming back to see us and keep on coming back to have repeat treatments. It's important to understand, however, that no treatment is perfect and no surgery or intervention comes with no risks at all. Some patients do suffer in the post-operative period with what is normally quite minor issues like throbbing, burning, perhaps a raised temperature, or an area of what we call thrombosis, which is where you get a small blood clot in the skin overlying the hemorrhoid. This might present as a hot, painful, or swollen lump by the bottom. Most of these, however, will settle with some relatively judicious use of painkillers or topical creams or ointments, or occasionally some oral antibiotics. It is incredibly unusual that you have to admit a patient to a hospital after having undergone a Rafaelo procedure, and most of any issues that might be encountered in the post-op period can be safely managed at home and would probably only amount to a few days' inconvenience.
So I usually say to patients that on the day of the procedure and the following day, they shouldn't schedule anything too important. I would probably take those 2 days off work, realistically. After that, it depends a bit on their recovery. So after the first 24 hours, if they have a really good recovery, they could go back to work the following day. But it's probably best for those who are able to work from home, to arrange to work from home for 3 days after the procedure. In terms of sport and other activities, there are no restrictions really on what one can do after the procedure. It's really dictated by the discomfort and pain symptoms. So there are no hard and fast rules. As soon as the patient feels okay to do whatever activity they like to do, there's no problem with that. None of these activities will adversely affect the healing of the hemorrhoid or the further shriveling up of the hemorrhoid. I think the most important advice is that this is an incredibly common problem, and please don't leave your symptoms unaddressed. There are many good options that we can recommend. Come and see a colorectal surgeon. Come and be checked if there's blood around, because sometimes blood in the stool is not from hemorrhoids, it can be from other things. So come and see a colorectal surgeon. Be advised about what treatment options there are. Not all of them are horrendously painful. In fact, a decent number of them are not too bad. And if you see a specialist, you'll be counselled and advised well. And many patients who come and have treatments come back later and say, I wish I had this done ages ago.